bida yani mu say oh how amanie oh hiada ne yamfutu kokoni dum sa wodwa ya namui oh beje yan efrimu no kwasem oh ya asere wadu asabuo baako ade achi a wo chinchini kwa benyina ose Ghana man yensientia onyina wa ma sansa didi pame asona ne wa yokobe asona duampem kwa de hyekonkura so ketwa so adare oso wa ya asona ba on prekwa wa prede di ade wo wi no sansa wa yokoba na wo mie enti me ya sansa me fa di a me de kire me fanso a me fa ni boom makano meyo ashabodi bosha so adodan kwa show boy premen ni dan kwa Akufo Addo why bio Ghana man yase ya bekoswa de wasedaka wona wo share yambo esa wo be ma yam free SHS every say ebra na hokire adokoro Ghana man na yakaya nsam kire man panyini dada na wode sha adum ne adan no na adodan kwa Akufo Addo mobro hunufu eja tema eja abadaye eja wo ba ya no wo be yi nkwanu akese we ya free yenkomu the free SHS aba asa emanyina yankwa SHS free wa bra yentia teku dama sempua kaprempa na wa mampanyine na adodan kwa Akufo Addo se nempo ya na wasia enchirime beba ebekasa bema ba wo be yebi ye bekoswa de wasedaka she na adodan kwa Akufo Addo ma yati asiase onyan shehai ema my fofra emfa won raba sem ene won crutch sem ensisi ya mangana na santino wasem mofreni yen dache mofreni yen anidaso mofreni betumi amagana etumi etum pon akoso enti free SHS na yen tetekune dama no oye nimdifuo oye womanimfuo oye kukodrufuo oye nimonyamfo na nimonyam nyira bejem enti na free SHS no SCP esita ashiri etina amampanyine na adodan kwa Akufo Addo yada wasia ensada ansoha wasada planting for food and jobs abaye planting for food and jobs abaye ekwama ye friend sekwam ebinde yana na yese wa mampanyine na adodan kwa Akufo Addo batampe yada wasia ensado Ghana maya bada swada wase ebra COVID-19 to ayempofrim na ni da swasaye na ya bisa ya wose ehemfa na yako every sana nkrafo jesa Ghana de kan fraho kaka wane tibremu na adodan kwa Akufo Addo yensenkyerani ema ye hunu ne sasa Ghana ya omai Joseph awoma ya yu asemada biara day woma yendedida obi ka kire yese warenam no akadompe nanso na adodan kwa Akufo Addo baye waseme ye Elijah mekasa nambaba dompe no ho enade waye ejuma wankwaso ebru wankwaso aso wona woma yemfo interchanges one district one factory one village one dam one constituency $1 million one constituency one warehouse single ticket inflation online passport application anso man panyine na adodan kwa Akufo Addo wayabi wase empanyimfo ne kasempi abua patupre wase obi benyame ana me yade yinti yade na mo nyanko pasachi osu sene ho sene tibone enti na adodan kwa Akufo Addo bema ba won kwa wo so dance wote chimase ena wo ba ya no wase wo ma ye hospitals ya rebiara wodi afabra won tra ho magana njingu enta tempan samosa enti na adodan kwa Akufo Addo waya bio Ghana man bekoswa da wase afia chamu ya ana wo share yambo na bidu se wontumi nye nanso wa kira se mimi framanyo ko papa mu ya de amamo papa na bo masuo enti mentra ho anya nhyehan emma Ghana njingu se enne bo shana bama ni yaso wo shabodi bo shasa na adodan kwa Akufo Addo onyina wo ma sansa didi pame asre wadi asabuo bako ade che wo chinchiri kwa banyina wo se wo man se asientia bema ba osiprekete otripuku so nyansa bu akwa nyansa bu nkama kanta wo so ya bekoso ade wasedaka ene ase hospitals no e wase mensni bia enya ayaresabia mantamu nsia bema benyansa ninim difuo ono na wodura kwanchen krampa wo hubi enti ya friend se ehunta hunu te katre wono na o ma ba to ena se waba na se wo hyase e wo tra de krodua yi mu a ni asema mpanyini yenya Yanshia, when Nimtifo, when woman for Ghana, my Yanshiawa, and Kawa the modern for the Wafado do 1 hour COVID-19 bremi. Nana, yet that was say, Ghana, my, because what there was Sadaka, money a Jumapa, one Pasua brew, one Pasua so, say, and Nana Ado say, well, yeah, Namma Yanka said, Supu to Puduma, Brawana, Suprupu, and a bra Suprupu, Dum Soprapa, and a Soprapa, Dum Suprupu, and Tamama Yanina, young son and Adubu, no one will any do, no one to me in a pinty, and fire a Sabia Duana Emra, I am me, Menewo, ya Dachintia, I am me, Menewo, ya Pomidintia, Shanipa Bakunsan Sunya Mianikato, and a Baku for Red Drusu, Penny from Pose, Baku for Son Cherdam for Mama Yanina, young Kaun say, Ghana Bekoswa and Tuma Perfra, and my Yaka Yafra say, ya woman, Nana do Bema Ba, one kwaso, Ghana my, Yabekoswa de Wasadaka, Mo and the Jumapa, and Jumaram Puntu Jumara, one kwaswa, Okudonto.
We are met this morning because of the ravages of COVID-19, which has affected every country on the planet. For us in Ghana, not only has the pandemic disrupted our daily lives, but it has also exposed the deficiencies of our healthcare system because of years of underinvestment and neglect. Indeed, in update number 8 of the Fellow Ghanaian series, I indicated that COVID-19 has revealed the unequal distribution of healthcare facilities in the country, as we have tended to focus our healthcare infrastructure in Accra, Kumasi, and 1 or 2 of our other big cities. As we have seen, epidemics and pandemics, when they emerge, spread to any part, can spread to every part of our country. We discovered that there were 101 districts in the country with no district hospitals, and we had to do something about it. The creation of the new regions also meant the government had to construct 7 regional hospitals for the new regions, including a new one for the Western region. See to the construction of 2 new psychiatric hospitals for the Middle Belt and Northern Belt respectively, and rehabilitate the Afian Kwanta Hospital in the Western region. This led to the formulation and declaration of Agenda 111. Following on from this initial announcement, a lot of work is being done to help make this vision a reality. And I'm delighted to be here with you in Trede to cut the sword symbolically for the commencement of construction of these hospitals across the country. So far, 88 out of the 101 sites have been identified, including this one at Trede, the site for the construction of the Etrima Kwawuma District Hospital. Work on the other 87 sites also commenced today. The acquisition of the remaining 13 sites will be completed shortly for work to begin. Each hospital is being constructed at a cost of $16.88 million United States dollars. That is $12.8 million United States dollars for construction and $4 million United States dollars for medical equipment. All the hospitals are to be completed in 18 months. Work will commence on the regional and other hospitals in the latter part of the year. These modern, fully equipped state-of-the-art hospitals will have facilities for outpatient services, including consultation facilities for medical and surgical cases, ophthalmology and dental services, a physiotherapy unit, maternal and child health unit, public health unit, 4 state-of-the-art surgical theaters for maternity, obs and gynae, accident and emergency, and for general surgery and imaging facilities. In addition, each hospital will have the full complement of male, female, pediatric, and isolation wards. Provision has been made for support facilities, which will include a kitchen, laundry, sterilization department, mortuary, energy center, maintenance department, and staff accommodation for doctors, nurses, and other health workers. Ladies and gentlemen, Agenda 111 has been carefully thought through to inspire activity and growth in various sectors of the economy and also help bring jobs to the youth. It is a Ghana First agenda, and the following facts will help make the point. Firstly, a consortium comprising some 20 Ghanaian consulting firms made up of architects, civil, structural, electrical, and mechanical engineers, quantity surveyors, biomedical engineers, and other technical teams have designed these hospitals to reflect our unique domestic requirements, including impact of climate, socio-cultural conditions, and traditional practices. They will also supervise the construction of these hospitals, which will be built by some 250 domestic contractors and maintained by domestic facility management professionals as part of government's policy of developing domestic capability in the building and construction sectors of the economy. This will undoubtedly help retain most of the money in the country to engender further investment in the economy. Secondly, the hospitals are of a standard design and construction to provide a blueprint for speedy and cost-effective implementation of future health infrastructure programs in the country. Thirdly, the execution of Agenda 111 will require significant domestic inputs, which will give impetus to private sector investments into the One District, One Factory policy. We have incorporated into this agenda a strategy of direct and indirect job openings to stimulate the economies of the various communities in which the facilities are to be located. These include the creation of an estimated 25,000 jobs during the construction and design phase, i.e., jobs for architects, civil, mechanical, electrical, and biomedical engineers, quantity surveyors, masons, carpenters, welders, steel benders, painters, tillers, and related professionals and artisans, as well as other indirect jobs. Once completed, it will provide job opportunities for some 20,000 health professionals, and thus enable the Ministry of Health recruit more doctors, nurses, pharmacists, and other health professionals. In addition to these, there will be many indirect jobs for residents in the local economy. For example, for persons who will sell food, drinks, hospital consumables to the hospital, its staff, patients, and visitors. I am confident that this important investment will have a positive impact on many lives and livelihoods in the respective communities. Ladies and gentlemen, beyond the building of these new healthcare facilities, my vision is to help make Ghana the center of excellence for medical care in West Africa by 2030. Leveraging on Ghana's favorable status in the region as the most peaceful country in West Africa, a beacon of democracy of the continent, and a land of opportunity, who have worked tirelessly to enable this project take off and remind all of us that we continue to experience the effects of the third wave of the pandemic. It is important that we continue to adhere strictly to all the protocols and directives government has put in place to protect lives and livelihoods. Continue to wash your hands under running water. Use alcohol-based sanitizers, hand sanitizers. Wear a face mask and ensure social distancing. These are the weapons of our welfare as we strive to reach the target of vaccinating 20 million Ghanaians, i.e., the entire adult population. I'm very hopeful that by the grace of God, we are on the threshold of something remarkable in Ghana. And I expect that within the next 18 months, God willing, we will all be alive and in good health to witness the commissioning of these hospitals. May God bless us all in our homeland, Ghana, and make us great and strong.